Transvaginal ultrasound. Legal disclaimer: information is for general and educational purposes only. Content is not nor intended to be a substitute for professional, legal, or clinical advice. While we strive to make the information as timely and accurate as possible, we make no claims, promises, or guarantees about the accuracy, completeness, or adequacy of the information contained and expressly disclaims liability for errors and omissions. Course objectives. At the conclusion of this session, participants will be able to verbalize the importance of transvaginal ultrasound, what transvaginal ultrasound is, the risks associated with it, and the benefits of transvaginal ultrasound. And you'll also be able to verbalize the different techniques and indications of transvaginal ultrasound. So why is this topic important? Transvaginal ultrasound is an important topic because it is a safe and effective way for doctors to examine the internal organs of the female pelvic region, including the uterus, ovaries, fallopian tubes, cervix, and vagina. It is commonly used to diagnose and monitor various gynecological and obstetric conditions such as cysts, fibroids, ectopic pregnancies, placenta previa, and cancers of the reproductive organs. It's also used mainly in early pregnancy because you're closer to the pelvic organs and you could see much more clearly. So as I mentioned before, it's also used during pregnancy to monitor the heartbeat of the fetus, assess the condition of the placenta, and check for any changes in the cervix that could lead to complications such as miscarriage or premature delivery. The procedure is safe, painless, and does not involve radiation, making it a preferred imaging technique for many doctors and patients. However, it is important to note that transvaginal ultrasound is a medical procedure that carries a risk of psychological harm to the patient, as well as potential for physical harm to the patient if not performed correctly. Therefore, it is crucial to ensure that the procedure is performed by a qualified practitioner who provides sufficient information to the patient and adequate time for the patient to respond. What is transvaginal ultrasound? It's a type of pelvic ultrasound used by doctors to examine female reproductive organs, including the uterus, fallopian tubes, ovaries, cervix, and vagina. Quick and painless imaging procedure that provides a more detailed view of the pelvic organs than a traditional abdominal ultrasound. During the procedure, a wand-like instrument called a transducer is inserted into the vagina, where it releases sound waves that bounce off the various structures inside the pelvis. The sound waves travel back to the transducer, where they're converted into electrical signals that project a real-time visual image of the pelvic organs onto a screen. The procedure can take anywhere from 15 minutes to an hour and doesn't require much preparation. A transvaginal ultrasound can show abnormal structures or growths in the pelvic area that may indicate a condition, diagnose a condition, monitor pregnancy, or plan for surgery. According to studies, there are no known risks associated with transvaginal ultrasound. It is a safe and straightforward way for doctors to examine the internal organs of the female pelvic region, including the uterus, fallopian tubes, ovaries, cervix, and vagina. It is also safe to perform transvaginal ultrasound during pregnancy, and there is no risk to the fetus. However, some women may experience mild discomfort or pressure during the insertion of the transducer, but this feeling should go away after the scan. If anything feels particularly uncomfortable, it is essential to let the sonographer or doctor know right away. In rare cases, bleeding may occur after the procedure, but this is usually due to blood collecting higher up in the vagina and the transducer may have dislodged it. It is important to note that transvaginal ultrasound is a medical procedure that carries a risk of psychological harm to the patient as well as the potential for physical harm if not performed correctly. Therefore, it is crucial to ensure that the procedure is performed by a qualified practitioner who provides sufficient information to the patient and adequate time for the patient to respond. Benefits to transvaginal ultrasound use. It offers detailed imaging, provides a more detailed view of the pelvic organs compared to traditional abdominal ultrasounds. Diagnostic capabilities, it helps doctors identify abnormalities and diagnose various conditions such as cancer of the reproductive organs, cysts, fibroids, pelvic infection, ectopic pregnancy, and placenta previa. It is also used to monitor the heartbeat of the fetus, assess the condition of the placenta, check for an ectopic pregnancy, and examine the cervix for any changes that could lead to complications. Safe and painless. Transvaginal ultrasounds are safe and relatively painless, and there is no radiation and poses no risk to the patient or fetus if pregnant. It offers immediate results. In some cases, patients may receive the results immediately if the doctor performs the ultrasound, or the images are saved and then analyzed by a radiologist. It's pretty versatile. It can be used for various purposes, including investigating unexplained vaginal bleeding, pelvic pain, infertility, and checking for cysts or uterine fibroids. So techniques. The patient preparation. The patient is usually asked to empty the bladder before the procedure. The procedure is often performed with the patient lying on her back with the feet in the stirrups, similar to a pelvic exam. A transvaginal ultrasound uses a specially designed transducer covered with a condom and a water-based gel for easier insertion and better image quality. So for probe insertion, the transducer or probe is gently inserted into the vagina. It can either be done by the person performing the exam, or you can offer the patient the option to insert it themselves. Some oblige and like that better for their comfort, and others will just tell you to insert it, whoever's performing the exam. The probe is usually covered with a protective sheath, such as a condom, and lubricated before insertion. The transducer emits sound waves that bounce off pelvic structures, and returning echoes create detailed images of the uterus, ovaries, cervix, and surrounding tissues. This technique allows for detailed visualization of the endometrium, uterus, ovaries, and adjacent pelvic structures. Transvaginal ultrasound is commonly used in early pregnancy to confirm intrauterine pregnancy, assess gestational age, and detect multiple pregnancies. Gynecological disorders, evaluation of pelvic pain, abnormal bleeding, and suspected gynecological conditions such as ovarian cysts, fibroids, and endometriosis. Infertility assessment, examination of the uterus, ovaries, and fallopian tubes to assess factors contributing to infertility. Monitoring ovulation, assessment of follicle development and ovulation in women undergoing fertility treatments. Cervical assessment, examination of the cervix for abnormalities such as polyps or tumors, guidance for procedures such as egg retrieval during in vitro fertilization or IVF, or the placement of intrauterine devices, also known as IUDs. Follow-up imaging, follow-up examinations to monitor the progression or regression of known gynecological conditions. In conclusion, transvaginal ultrasound is an important diagnostic tool for evaluating the female reproductive organs, including the uterus, ovaries, fallopian tubes, cervix, and vagina. It is a safe and non-invasive procedure that provides highly detailed images of the pelvic area, allowing physicians to make precise diagnoses and monitor pregnancies. The procedure is versatile and can be used to investigate various conditions such as cysts, fibroids, ectopic pregnancy, and cancers of the reproductive organs. While there are no known risks associated with transvaginal ultrasound, it is important to ensure that the procedure is performed by a qualified practitioner who provides sufficient information to the patient in adequate time for the patient to respond. Patients may experience mild discomfort during the procedure, but this should subside shortly after the procedure. It is crucial to recognize that transvaginal ultrasound is a medical procedure that carries a risk of psychological harm to the patient, especially for survivors of sexual abuse. Therefore, it is important to ensure that the patient's privacy and dignity are respected during the procedure. Overall, transvaginal ultrasound is a valuable tool for diagnosing and monitoring various gynecological and obstetric conditions, and is essential to ensure that it is performed safely and with the patient's well-being in mind.